Well, welcome everybody.
Good night.
Get going. I'm Steve Crowley. I'm a energy chair for the Vermont chapter of the Sierra Club, and I'll play host tonight for our community conversation. This is about we were trying to figure out our 8th or 10th of these community conversations. Tonight is going to be a great discussion about health and climate. And we've got a couple of great presenters and should be a great discussion. So I'm going to take the slide down here so we can see. And our two presenters tonight are Dan Quinlan, who's the director of the Vermont Climate and Health Alliance, which is an organization he started, about 2 or 3 years ago, maybe, and has been doing a lot of great things over the last 2 or 3 years. And he'll describe some of what they do and what some of the issues are facing climate and health. And then with him is Stephanie Clement, who is a student, a graduate student at the School for International Training, and is an intern with Vermont Climate and Health Alliance this summer. And she's going to describe some of the work that she's been doing and projects they're working on. So I'm looking forward to this. The way this usually works is they'll do some kind of short presentations first off, and then we'll roll right into a more open discussion. I think I'm going to hand it off to Dan Quinlan. Welcome.
Hi, good to see all of you here on this screen, of which we're probably all staring at these too much these days, but it's nice that we are able to connect in the age of COVID. So by way of introduction, I'll take you quickly through my story a little bit. Help set the stage. So my original background is as a physicist, and it was actually in the late 80s I first heard about climate change when one of the mathematicians that I worked with in the lab I worked in was given the data by NASA, and to try to give his job was to give an independent review about whether the temperature was actually rising in the data set. And for a extremely well-known mathematician, this is about a 2-minute problem. If that, but he applied a lot of more than needed statistical analysis to it. And of course, demonstrated back then that the temperature was indeed rising. And we had a little bit of conversation at the end of that about what it meant, but I don't think anybody in the room, and there were a lot of people in the room, 30, 40 people in the room, really, we certainly didn't understand what the implications of that were. So fast forward 20 or so years, 20 plus years, and I really got interested in this topic, and I left the for-profit sector and went to the nonprofit sector, and I was working up here at VEIC, and that was kind of my introduction to the nonprofit efforts and advocacy efforts around this work. So a few years ago, I started doing some work with an outfit called Healthcare Without Harm. It's a very interesting organization out of Boston. And they started initially about 30 years ago on getting toxic chemicals out of hospitals, just in Boston. And they're now a worldwide organization. They work in toxic chemicals, clean energy, or energy use in hospitals, food systems, et cetera, et cetera. So their work is around healthcare systems and making them more sustainable. And they're now a global entity, and the guy who started that won the MacArthur Genius Award a couple of years ago. And in talking with him, I was doing some work with that for them. This whole topic of the idea that medical and health professionals were an important voice in the work to do something about climate change came up, and is one he's been advocating for years now. So we collaborated on trying to spin up a group in Vermont, spin up a group of medical and health professionals in Vermont, and one in New Hampshire. And we were successful in Vermont. We're still working on New Hampshire. And that was, as Steve said, about 3 years ago, we got rolling, 3 years ago and change. And there's about 5, 6 groups like this in the United States. And we started by taking a group, by taking an idea that the group in Minnesota had, which was to write a letter to the state government and get a lot of medical professionals to sign it, and then bring that to state government and use that as a way to start to talk to the legislature and senior legislators. So that's what we did. And we got about 250 people to sign it. We got the Medical Society to sign it, the Vermont Medical Society. We got the veterinarian group in the state to sign it, and a few other professional groups. And that's what got the ball rolling, both in terms of gathering a group of interested health professionals and also to be able to go into the State House. And that letter enabled us to go in and see Governor Scott. Our group consists of anybody who is in any way, shape, or form connected to health or medicine. Most of our people are clinicians or practitioners, but we also have people who work in other aspects of healthcare, administration, IT, et cetera. And we're also very happy to have as a partner, and this is the Vermont Veterinary Medical Group, who've been very active. And interestingly, when we went to meet the governor, he was most receptive to that part of the conversation, because I think he understood what was going on with ticks and the explosion of ticks in the state. So since that time, we really have two branches that we work on. One is on education and one is on legislation. And so on the education side, we find every opportunity we can to talk to the public, to talk to medical professionals about climate change and health, and in all sorts of forums, from small group meetings like this. There was a movie showing that we did with Interfaith Power and Light all over the state, and did a lot of presentations with them. We'd show the movie, then we'd have a panel discussion. One of our folks was one of the speakers at the student climate strike last September down in Burlington. So there was the image that you can have, and this is this basic strategy. This young mom, who's also a family doc, was up on the podium in her white coat to have that very visible presence of a physician. And she talked about her concerns, both as a physician, but also about as a mom with young kids. So that's basically our strategy, to get that voice out there. And we do a lot of, each year we go down to the State House, we do a State House Day. Each year we're very small. We're a lean and mean organization with basically no budget. So what we do is we work with the other advocacy groups in the state, try to understand what bills are coming forward, and then pick one or two bills that seem to have a lot of potential for impact, and then do what we can to help get those through. On the education side, last February, we did a community medical school event at UVM, which was very well attended. There were 100+ people there. And we had a physician and also a researcher from the Gund Institute who knows quite a bit about climate and health, and they spoke. So it's that kind of mix. And I can say more about other activities maybe a little later. But if we could jump to that slide, Steve, I could talk a little bit about that. So the slide that's going to come up here encompasses why we're so concerned. This slide's really easy to find. If you go to the CDC, this is that Center for Disease Control, and put in climate change, this slide will pop up, you'll see it. And similarly, the Vermont Department of Health has done some really wonderful work on climate change and health. So again, these sites are easy to find, but if you contact me, I'm more than happy to link you into these things. So this slide summarizes the whole enchilada. There's a 32-page executive, just the executive summary behind this, and then there's a very long report that goes through all this material. So this was created by the CDC. Well, actually, it was a cross-governmental effort and this got published shortly before the current president came into office. And fortunately, it remains on their website along with the report. So here's the idea. In the center, as you can see, there's the physical ramifications of climate change and rising temperatures. And then you can see that middle circle, which begins to link the physical changes to health. And on the outside, you see the 8 wedges that reflect different health concerns. And one we hear a lot about here in Vermont is the changes in vector ecology. So over at about 2 o'clock there on the diagram. So we hear a lot about Lyme disease. We hear a little bit about West Nile virus. There's a couple others that are coming, but a vector ecology means insect-borne disease. So that's been a topic of great awareness, I'd say, in Vermont. If we go down, then what we're seeing, and maybe some of you are suffering from this, I certainly am, is the change in pollen counts, and the length of the allergy season has changed quite a bit, and it's impacting a lot of Vermonters. Then we come around to water quality here in Vermont, where the issues are mainly about the buildup of cyanobacteria in parts of like Lake Champlain, where the water is fairly stagnant. And also massive outflows of untreated water from our sewer treatment facilities in heavier rains, which the state is starting to address, but that's a very big problem. Continuing around the circle, we have a lot of concerns around water and food supply impacts as time goes on. There's a lot of questions about what's going to happen to our farming community. And there's actually pros and cons to that, both as thinking about state and the state of Vermont and also nationally. But in the long run, in the very long run, it's not a good story. Then we come around to environmental degradation generally, forced migration, civil conflict. Those are areas, if you go and do some reading about some of the wars that are happening in the Middle East in particular, in Syria, there's a lot of people who argue that the core driver of the Syrian conflict is actually agricultural problems that came about because of climate change. And obviously in those parts of the world where the heat's going to go up such that farming is no longer viable, that's going to cause a huge problem. It's also a big problem already in sub-Saharan Africa. Coming around to extreme heat, we're having more and more heat events in the state. The Department of Health has done a really interesting job of forecasting what's already happening, data that already shows we have more people going to the emergency room from heat events than we used to. Similar on rain and some other things where they've done some really nice modeling to look at what's really happening in Vermont. Come around to severe weather, that's when I think we all get massive hurricanes. We've had our own battles, Hurricane Irene being the big example. And embedded in that one, but embedded through all this is the issue of mental health. And so more and more, there's many different aspects of that, and people are getting more academic about that. So in the sense, if you have people who are directly affected by single big events like a hurricane, then you have people whose livelihoods are affected, say people who are no longer able to farm where they live. So that's a more longer term over a period of time event, but has mental health impacts. And then there's the rest of us who worry about these things, and for good reason. So that the mental health aspect of this has actually gone from the bottom of the pile to the top of the pile, I would say, in terms of health professionals and what they're talking about and what they're analyzing. So this diagram, we use this all the time. The governor's seen this twice. I would say each time he nods his head a little bit more, but we have some more work to do on that front. We use it a lot in state government, and we use it in all our public presentations. And some people, like the people on this call, I would think probably get it right away, and others, they're not so sure. So we present all the data we can to back up our arguments. These things are here and they're coming. So with that, I think I'll turn it over to Stephanie and let her tell you about what she's up to.
All right, great, thanks, Dan. Hi folks, thanks for joining tonight. My name's Stephanie, and I'm a grad student working with Dan as an intern. I'm at the School for International Training, and I'm studying my master's degrees in climate change and global sustainability. So as part of this, we are to do an internship or a practicum in a field of our choice that relates to climate change or sustainability. And I'm going to give you a little bit about how I ended up in this area and interested in climate and health as well. So I did my undergrad in international development and have worked in the Peace Corps and seen a lot of a lot of the effects of climate change on agriculture and on livelihoods in rural areas, on the most vulnerable places, mostly in sub-Saharan Africa. And that's sort of where the idea was sparked, realizing how connected we are to the ground, to the earth, to nature around us, and realizing that the slightest changes in our weather patterns can really have lasting impacts, not only on individuals, but also have far-reaching impacts as well, on food security, on everything. Dan touched on a couple of these things. So upon my return to the United States, I worked actually in a mental health field, but it was in wilderness therapy. So I was really working at that nexus of finding solutions for youth who were having trouble with their own behavioral problems in wilderness settings, and really taking advantage of the nature that we had here in Vermont to be able to help these adolescents and young adults. And after that, I worked as a licensed nursing assistant in the health in the medical center here at the university. So working in all these different sectors in both the environment and in environment and mental health nexus, and also in the healthcare system, really drove me to, I'm also a millennial, so, climate change has sort of been in the periphery for my whole life. It's been a part of the conversation, my whole upbringing. So I really wanted to understand further how we could work and get the message out to recognize that climate change is not just an external idea that's happening, somewhere far away with sea level rise, but it really has individual impacts. And so I really wanted to help or figure out a way that I could help portray those ideas. And sorry, I got distracted by this. Help portray those ideas and really learn more about what climate change means for human health on an individual level. So when I learned about Vermont Climate and Health Alliance, Dan was nice enough to take me on. And what I've been working on for the summer is the connections between climate change and the COVID pandemic right now. What lessons are we learning from the pandemic? How are communities responding? And how can we apply those lessons to climate change? So along that idea, I have a bunch of, I don't have a beautiful chart like the CDC's. However, I have a couple of points that I think, many of us may have thought of, some of us may not have, but a few of them are, I think Dan alluded to this just now, but with climate change, we recognize that the earth we're living on, everything is really connected. And we are seeing that pretty deeply right now with COVID, with the coronavirus crisis, that everything is really connected. We are really reliant upon each other, and we're reliant upon the food systems that are able to feed us. We're reliant upon our healthcare systems. We're reliant upon the truck drivers who can bring us the goods. Every single part of our society is connected, and we're really seeing that. So it's leveraging that idea that we're connected, and recognizing that nobody is immune, not from coronavirus and not from climate change. So really kind of bridging that gap, being like, hey, this is an example, this current crisis that we're going through, of something that is also another global pandemic that we are seeing on a global scale as well. Another thing that the COVID crisis does that will also be highlighted by climate change is that it really highlights the inequalities and the disparities in our societies. The most vulnerable are going to be hit first, and they are being hit first and hit worst. So recognizing that and being able to work from the ground level and helping those communities with their own resilience and their adaptability is essential for coronavirus, and it will be for climate change as well. And another point is that we are adaptable and we are resilient, and we know we're innovative. We've been able to take entire universities and move them online. We've been taking, just like this conversation group and moving it onto an online platform. We're able to adapt to social distancing norms. We're able to change the way that we interact with each other. We're able to change the way that all of our businesses are run. We're able to support each other in ways that before we maybe didn't think of. In Vermont, individuals are, I know, and elsewhere I've heard and read about as well, individuals are sewing tons of masks for folks and distributing them. There's free testing for everybody that's being allowed. There's all sorts of things happening that are proving that we are really adaptable to these unusual circumstances and situations, and that we can plan for oncoming changes and really adapt and be resilient to those as well. So those are sort of some big themes that I'm working with. There's a lot more, but those are some larger portions of the connections between coronavirus and climate change that we are trying to get out and talk about and learn about. And there's actually, I just read today, if any of you all have the New York Times climate change newsletter, they're starting a new series. I believe it's another webinar called Netting Zero, and they're talking about this exact topic, the lessons learned from coronavirus to be applied to climate change, and I believe it's tomorrow. So I can send that link when I get a chance. But so that's a general idea. So.
So great. Well, thanks so much. It is one of, I think for a long time in the climate discussions, the concept of climate and health were pretty silent in all the discussions, and it's becoming more and more apparent that this is something we can't ignore. So thanks both. I have a quick question for Dan. Dan or Stephanie, the legislature recently, one of the things that the Senate did before it went temporarily home was to pass a bill that is like a planning bill on climate and health. And between that and the Global Warming Solutions Act, there's a lot of planning for climate adaptation that people are talking about. Have you followed that, and do you think that's a step in the right direction? Do you think that helps?
Dan, you're muted.
Okay.
There we
All
go.
right. I'll start, and Stephanie, if you want to jump in. Stephanie, by the way, wrote a great piece in Vermont Digger about this very topic, if you want to go look for that.
Great.
And so, of course, the Global Warming Solutions Act is a piece of legislation that we think is pretty good. It's potentially quite powerful, and it's really wonderful to see that go through. And I think people, well, it's not all the way through, but it looks like it's going to go to the governor's desk shortly. And we could talk about that later if people want to ask about what that is. The other bill, which is quite different, is S185. Ginny Lyons and Dick McCormick put that together. That's passed the Senate. It's now in the House Human Services Committee that Ann Pugh chairs. And what that is saying is that the state needs to provide plans for thinking about, it's similar in a way to the Global Warming Solutions Act, but it's very health specific. So the state has to come up with plans for how to minimize the impacts of climate change on the health of all Vermonters, and then be reporting on that in each year. So it's very unusual. I have not seen a bill like this in other parts of the state and the country. And how it would actually work is we will see if it passes, and hopefully it will. But the important thing about this bill is this focus on health. It's going to really require state government to really absorb and understand what the Department of Health has already been doing, some really wonderful work, and that climate change is fundamentally a health and well-being issue for all of us, our kids, and people after us. So it's going to highlight, it's certainly going to highlight and elevate the discussion, I think, about the health impacts, and hopefully make all Vermonters more aware of it. So it's a good bill, and I would encourage you to, folks on the call and others, to go read it and see what you think. And if you think it's a good idea, to get in contact, particularly with your House members. That's where the bill sits right now.
Stephanie, do you want to add anything to that?
I think that it's just it's a really big step forward in that it's really recognizing something that the World Health Organization has recognized for quite a while, is that climate change is the #1 public health issue of the 21st century, and really taking the steps to acknowledge that and act upon it is extremely important for our well-being in the future. So Dan pretty much nailed the rest of it.
Yeah, great, great. I want to go to Jack for a question or two, but I also want to encourage other people, if you have questions. One thing you can do is raise your hand. You know, if you go at the bottom of the participants list, there's a button to click that will sort of raise the little blue hand. Or you could just in the chat box, you could either type out your question or a brief version of it, or just say, I have a question, and we'll try to pay attention and get to you. Jack.
Yes, well, thank you, Dan and Stephanie. This is really, as always, a very interesting conversation that we've got going. I'm going to ask about one intersection between public health and the climate problem that has cropped up just recently, in particular, as a group of scientists has pointed out to the World Health Organization that the COVID virus, from people simply talking, lingers in the air of enclosed spaces for a half hour, an hour or more, and that this is an important part of transmission of the virus, the small aerosols lingering in the space. And they say a big part of the solution is to improve the ventilation of buildings. And as it happens in old buildings, when you improve in our area the heat system to get rid of fossil fuels like an oil boiler or a propane system or a wood-based system, you turn often to ground source or air source heat pumps. And by their very nature, the heat pumps have a lot of air exchange. And so here we have a proven technology that with the right electric source can eliminate the emissions of carbon dioxide from heating an old building, and at the same time preserve the use of that building for public gatherings as long as the coronavirus is continuing to walk among us, which is, I'm afraid, going to be a long time. Have you heard much discussion of that, and do you see much potential for addressing with that kind of infrastructure program the twin problems of COVID-19 and climate change?
So one of the things that I do in my professional life is, and this is how I started out working with healthcare without harm, was going into a lot of healthcare facilities. And they use an enormous amount of power. They use about 2.5 times the power of a conventional kind of other commercial buildings. And so they're using a lot of power and their energy bills are very high. So there's a big incentive to think about all these systems. So what you're pointing out, Jack, is a really important thing, because typically the way you would solve this kind of problem is you have to put in additional filtration into the air handling system, which means that the system has to push even more air against this thing. You can imagine air flowing through a duct. You've now got this increased filtration there, and it takes more power to push the air through it. So that's an area where we really want to see a lot of novelty and in these other kind of buildings, because if everybody just starts putting in these conventional solutions into their buildings, into a typical commercial building space, we're actually going to see our energy consumption go up, which would be a bad thing. So to the idea of bringing in new technologies that get us away from conventional air handling is extremely important. So we're going to get the double benefit out of that. So yeah, absolutely, opportunities abound like that. And I think we're only beginning to see the leading edges of that as people think about buildings quite differently than they did even 6 months ago.
Steve, I have another question. If you're able to enable screen sharing for me, that would make it easier for me.
Well, let's see.
Or
I'm
maybe
not
wait.
sure I can do that at this point
Okay,
in the meeting. I think that's
let's just see what
the
happens.
opportunity was in the setup.
I think
Okay,
I'm good.
try now. I think I did it.
Yeah.
Oh, okay, good. Yeah, Rachel
Okay,
has
so
more.
I just want to point out to people that within the past week or 10 days or so, the House of Representatives in Washington Special Committee on Climate Change that Barbara Boxer established under some pressure last year came out with a very comprehensive climate plan, which is essentially produced by the Democrats on the committee, but which gives a template as to where the House majority would like to drive the climate solution. And as you see here, this is a page deep in this 400 or 500 page report, but it will be easy for you to locate, in which they walk pretty comprehensively through a federal agenda. And if you're looking for guidance on where the doors are beginning to open in the Congress, this is a very useful document. So I think I can just share the, I figured out how to stop the share. And in the chat box, I will paste the URL for this document. And everybody can just bookmark it if they're interested. And then with that, I'll ask the question, Dan, you work at you work at did I say something other than Nancy Pelosi? Steve, I meant to say Nancy Pelosi.
Or Boxer, you said.
Oh. Well, at least I didn't say Tip O'Neill. Anyway, I posted the URL for that. My question, folks, is do you see much action at the federal level as opposed to the state level where you spend most of your effort currently? And how are our congressional delegation and senators, a tiny congressional delegation, doing at promoting this agenda in Washington?
Well, I think, as we all know, our particular delegation is one of the standout delegations in the country and has been for a long time. That's hugely encouraging. At the other end of the spectrum, I don't know if you all remember, but it wasn't very long ago, Senator Inhofe was sitting in the Senate chamber holding a snowball, talking about, well, climate change isn't here. We've got snow outside, on the Capitol steps. And we still have a lot of those folks sitting, in Congress. There's a really interesting movie. This is one of the movies that we were taking around the state, Vermont Interfaith Power and Light, and we were called Betsy Hardy and I were doing this. I'm sure a number of you know Betsy. So it's called The Merchants of Doubt, and it's about how the oil industry basically sold us all a bill of goods that climate change was not a problem. And it starts by going back into the tobacco industry and showing how the same tactics were used on fossil fuels that were used in the tobacco industry. The fossil fuel industry is over the top 20 companies. It's either their book value or their revenue, I don't remember, is over $7 trillion. I believe I have that right. It's enormous. So that's a long way around of saying my feeling is the way we win this battle is at the state level. We're going to get out of the state level because the federal level, the lobbyists are just too powerful. I think that's probably my opinion. That's why we saw the Obama and his administration not get as far as we would have liked to. And if you go back in history, and Jack, you probably know this better than I, different large social changes happened at the state level. Back even going almost similar to what we're having right now 100 years ago, 100 plus years ago, where the robber barons were kind of taking over the country. A lot of that pushback was happening at the state level. So my argument is the states are going to get us out of this. And there are groups like ours, as I mentioned, in other states. And there is also if you don't buy my argument and you think it needs to happen at the federal level, you'll be happy to know there is the Medical Society Consortium on Climate and Health. They're taking all the national medical groups, AMA, pediatricians, all those groups, and doing the same thing we're doing at the state level and going in and arguing in front of the federal level. So I wouldn't be surprised if that document that you showed us, which I hadn't seen, came out of that group and some of their key partners. So there's good work going on at both the state and the federal level. I really like the idea of, we're going to do this at the grassroots at the state levels and show states how to do it. The states will show how to do it right, and then we come forward. And I'll point at states that, like, we all know California has been a real leader in this work for a long time, but Massachusetts is coming on strong. New York's coming on strong. We're seeing a number of other states who are really, New Jersey. I'm doing some work in New Jersey. The new governor in New Jersey just announced a 300, I was on a call today about this press release, $300 to $400 million wind turbine port. So it's going to be a facility where people who want to do offshore wind will come to this site in New Jersey, and they can do all the staging and things, and then take these systems out to sea and put them up. So we're seeing the states really doing some cool things.
What's your impression, Dan, of the role of the schools of public health? I notice in the media coverage of the COVID crisis that the deans and faculty of all the big schools of public health are playing an enormously influential role in bolstering the science. And with a few exceptions that I'm familiar with, in Boston, BU and Harvard both played prominent roles, but I didn't have the sense that they were as vocal on climate change. Am I wrong about that? What's your impression?
Well, I'll say the American Public Health Association was way ahead of the AMA on this, for examples. So I think it was 2 years ago, the American Public Health Association, it was the year of climate change. And their annual meeting was about it, and their chapters were talking about it. And then our interactions with the Vermont Public Health Association, they were ready partners when we started this. They were primed for this work because they were already hearing about this through their contacts on the public health side. So could there be more? Probably. But I will say the public health folks have been way ahead of the medical folks. That's even true today. So that's
how
my
about how about in academia? Stephanie, do you observe a high level of involvement in public health academia?
I can't speak necessarily directly to public health academia. I can speak to the folks who I've been talking with here at UVM and at a couple of other institutions. And it seems as though, I'm sorry, wait, can you repeat your question?
Well, I'm just wondering about the level of engagement on public health and climate in the university system, as opposed to at the agencies or in the professional organizations.
Yeah, absolutely. I think because what I've been hearing is that because a lot of folks are not necessarily able to get the funding on a federal level that they would like in order to do direct and focused climate change work, a lot of that work is being repurposed or refocused or added on to COVID or public health related topics. So what is happening is that instead of, on the surface, it looks like it's focusing mostly on the impacts of the coronavirus pandemic, but it also has a component of climate change. So it's a little bit more indirect, but I think they are still trying to be as active as they possibly can in order to get the grants that they would like to do their research with.
Great. We have a comment from Peg Elmer. Peg?
Hi, thanks. I'm loving this discussion. It's just, before I just retired a couple of years ago, I was doing hazard mitigation planning after Tropical Storm Irene and found the state devoted to the issues of flooding. And I love Dan picking up on the bringing forward the Department of Health's work on climate and the health issues related to extreme temperatures as we're headed into 2 days of high heat. That Vermont is really not prepared for this in any way, shape, or form. And that they started tracking fatalities across the state. The first year they actually were blaming some fatalities on high heat, and then I think they felt that they couldn't, the autopsies, there weren't autopsies being made, that they couldn't, they're being scientists, that they couldn't totally identify or attach those deaths to high heat. In the subsequent years, they're just showing how the fatalities rise on days of high heat over the average in the state. So when we lost 3 people, I think, in Tropical Storm Irene, we lost 3 people that first summer that they started tracking deaths in the state. And you don't hear anything about this. So it's the same thing that Jack was talking about in terms of, how are we going to cool the state and for an aging population? What's going to happen when everybody's buying air conditioners? So I just wanted to bring up again, because I've been this kind of lone voice with Enrique Bueno, who's a construction contractor in the Green Building Network. We've been sort of alone in the Act 250 reform effort because the flooding stuff is covered very well. And the whole Act 250 reform effort in the legislature has been about climate change. That was ostensibly the reason for bringing it forward for the next 50 years. And there was language in there about climate change, but nothing about extreme temperatures. I got them to add the words extreme temperature, but I was trying to get them to also add words in criterion 9F and M about encouraging site and building design to maximize passive heating and cooling, because there's an enormous amount we've lost in the last 30 years of having criterion 9F and never really pushing for just that passive bit. And because, I bring forward the Department of Health's website, and show them the PowerPoint and show them, and I just want to make sure that at least this group knows that the Act 250 reform kind of foundered in the Senate. It passed the House with all this language in it, H 926. And then when it got to the Senate, because of COVID and because of needing to just pick pieces and bits to move forward, VNRC pushed really hard for their forced fragmentation and road rule, just the issue of rural sprawl. That's big, and they've been fighting for it for 7 years or 6 or 7 years out of the bill. And that messed up things completely. They tried to attach it to an affordable housing bill. And enough of us were yelling and screaming about taking, a few pages out of a 30-page bill and leaving it at that for the reform of Act 250. That kind of stopped. And now it's back as H 926, but it didn't make it out of Senate Finance before they recessed for August. So it still is a viable bill that people can address to try to at least, it's a huge opportunity, not just planning and policy-wise, but for the implementation side of the large development that's 30% of the development that happens in the state. What a difference it would make if we could get them, the architects, the landscape architects, the engineers, they know how to do passive building and site design to maximize passive heating and cooling. They've known how to do it for a very long time. And if the words were there and they caught it when they're designing a development, they'll do it. And I think that the district commissioners could pick up on it if we could just get the words in there. So that's just
people may not be familiar with 9F.
Okay. So there's 10 criteria of Act 250, and there's a lot of sub-criteria. So there's actually like 30 criteria. But 9F is energy conservation, and they upped it a little bit. And then criterion 9M is added in this reform bill, and it is climate. It's about climate. Mm-hmm. And all of that is lost in the Senate version. It's just the forced fragmentation bits. So we just when it hits the House side, it's the full bill. So there's an opportunity in August to try to get something back in there. They should take the changes to the 10 criteria were great. They should at least take the revisions to the 10 criteria and put them back in there. So that's it.
There's a lot in there, but maybe I'll start, Stephanie. Part of what you were talking about there was the impacts on vulnerable populations, and that's something that Stephanie's thinking a bit about as it relates to COVID, as we're seeing that. So, Stephanie, you want to say something about that, and then I can riff on some of the other stuff that you were talking about.
Well, I think as we're hearing more and more, especially with the Black Lives Matter movement becoming much more on the national stage and international stage as well, we're really seeing and hearing more about how the coronavirus is impacting Black and communities of color and disadvantaged populations a lot more intensely and a lot more immediately. I believe even in Vermont, there was an outbreak within some new American populations who are generally a little bit more economically disadvantaged, as many other folks in the state. So it really is just it really is just showing those disparities in a different kind of light, and also, like I said before, really bringing to light those parallels between how they're being affected now and how they're going to be affected by the impacts of climate change. In terms of Dan, in terms of what else would you looking for me to touch on with this?
Well, you hit what I was hoping exactly you'd hit. So what Stephanie's trying to think about is, how does what's going on with COVID potentially give us new openings to talking to people about this? So COVID is demonstrating some of the impacts on our vulnerable populations. And climate change, the thing we talk about a lot about when we go out and give presentations, and we can use Hurricane Irene as a great example. We can use the recent heat event issues also as an example with real data, that the in our case, it's mostly low income folks, low income and the elderly. But generally, you could say vulnerable populations get hit hardest, and they get hit first and hardest, whether that's in Vermont or in Africa. And COVID provides us the opportunity to show that. And that's the kind of thing that Stephanie's working on. How can we look at what's going on with COVID that people are hearing about, and then talk about it more and say, okay, and this is why we want people to engage on climate change. So it's a messaging kind of thing that we're trying to do. And then there's more, I don't know what the other word would be, kind of what Jack was talking about before. That's not so much messaging, that's real implementation. So we're trying to look at COVID in all those dimensions and pull it out. And there are other people, as Stephanie mentioned, this thing started tomorrow with New York Times. So we're trying to, and Bill McKibben's done some great writing. We're trying to pull in all these sources and then think about how we can take that and message it to Vermonters. You'll be, if you've never spoken to Jared Ulmer at the Department of Health, he's done really wonderful work, and he's done groundbreaking work that we've actually been able to take into other states. Some of the work he's done on weatherization, nobody else has done in the country, showing the connections between energy efficiency, weatherization, and added health benefits that that no one hadn't thought about before. So this is another big topic of the Climate and Health Alliance and nationally. It's the idea of co-benefits. If you can get people out of their cars and walking and biking, there are co-benefits to those people because of their own improved health. They're getting more exercise. On weatherization, when you weatherize a home, you also tend to reduce moisture and mildew in the home, and often particulate matter, which then impacts the health of the individuals. And if they have a kid who has asthma or other respiratory issues, you could be saving them a trip or two to the emergency room in a given year. And Jared actually modeled that out and came up with a number. And it's a significant number. It's about, well, people argue about how much you save on weatherization. So, it's like 750, I've heard as low as 750 to as over 1,000 for an individual family on reduced energy costs. The health care bill is out of the similar, the modeling Jared did, is $250 a year and up. So it's getting close to the same order of magnitude of the benefits due to weatherization. So there's all these co-benefit ideas, and the co-benefit ideas are also, for the most part, well, I don't know if I could back this statement up, but my gut is that for the most part, we're going to see the impacts on most the vulnerable populations, the positive impacts of those co-benefits, the most in those communities. So you covered a lot of territory in your thing. I tried to hit a couple of the points that you mentioned.
I think one other aspect of co-benefits that I was just reading about recently is, and particularly with relation to equity, is the analysis of how much green space there is in urban communities, and you can almost imagine, even thinking about Burlington, which has a lot of green in it. There are trees all over, except not quite all over. You know, if you go look around the old north end of Burlington, which is the lower income part of Burlington, you know, there's just not as much green as there is everywhere else in the city. And, you know, that's something that people, I think, are starting to look at. And there are obviously, you know, there's the urban heat island benefit. There's the, I think, the mental health benefit of having green space around, a lot of those co-benefits, and obviously carbon sequestration. So all of those things. How about other questions or comments, people?
I'll ask one unless somebody else wants to jump in. I just, I guess my question is more about what Stephanie was saying about lessons learned from COVID, and that what we can apply to climate change. And one thing that I feel like I'm learning, or maybe I already knew, is that, you know, some states really aren't on board with COVID. They've made it a political issue, and they're seeing really, you know, I'm from Georgia originally, and we're seeing increased cases around the country. And so I do see that some states are a leader and can be leaders, and I see the benefit of local action. I'm just wondering, how can we tackle something as big as climate change when one of the lessons we're getting from COVID is that people are politicizing scientific, health, environmental issues, and it's getting in the way of progress. So just wondering if you could comment on that.
I mean, that's the issue for everything, right? It's how do we get people who don't care to care, or who deny to care. With the states who are on board with coronavirus, I mean, there is a parallel with folks who aren't on board with believing in climate change or wanting to act on it. I mean, we see that on a federal level where the United States, you know, has pulled out of the Paris Agreement. So really, I think while there is a lot of value in working with folks, kind of winning hearts versus minds, saying, you know, having the individual impact, because we are a nation of that puts a lot of value on individuality. So having the messaging be around the individual impact of climate change, the individual impact of coronavirus, how is this impacting me personally, you personally? I think that rings a little more true for a lot of folks, and can maybe kind of move the needle a little bit. How that's done is, you know, we have personal stories. We have personal stories and anecdotes only go a certain way, or go to a certain degree. I think people really need to see it, feel it, touch it, to be able to understand it. And something as heady and as big as climate change can be easily poo-pooed, denied, ignored, because it is so large. And so many people don't necessarily see the effects because they are a little bit slower in the way that they move, and they are oftentimes seen more, I wouldn't say extreme places, but on coasts, on low-lying islands, in areas that are already prone to drought and flood, are seeing this higher increase. In places like Vermont, we are seeing it. We are, like with Tropical Storm Irene, with the increase in Lyme disease, with ticks, and the increase in hot days and percentage of numbers of hot days in the summer. But it is slow. So I think being able to make those changes more visceral and more pointed, or being able to have them stand out a little bit more, makes people realize what's happening on a larger scale. However, I I think what Dan has said about it's up to the states on an individual level, I think that that really is going to be the case. And you can even bring that down even more granular to communities, towns, counties. Whether or not your state is acting upon certain things in climate change, there are ways and there are things that communities and towns can do. And yes, it is a smaller impact, but it is still an impact. And so I think that even with all of that denial or politicization, there's still action to be done, despite what a state or a country might be saying on the governmental level. I mean, we could go really into that and kind of pull that apart a lot, but that's at least my belief. And yeah, really, I think the most important thing out of all this is to make climate change feel tangible and be seen more than just understood cerebrally.
I think what I would add to that is there's at Yale and at George Mason University, there's groups that are really thinking about climate change communication and have for a while. And in fact, the George Mason group has a former Republican House member who has an avid person who's been talking about the need to work on climate change for quite a long time. So they are really thinking about this messaging and generally before all this started. And what I'm hopeful about is a couple of things that come out of COVID. One is we've seen the medical community step up, and we've seen frontline, not just the medical community, a lot of frontline people stepping up and taking care of the rest of us. The response has been incredible. And the response to those people in support of them has been incredible. So I think it shows the potential. We're going to solve this problem as a communities. We're not going to solve this as individuals. And COVID is an example of what you can do when the community pulls together. That's one part. And frontline, the medical community, our whole argument, as I said before, is if you can put people in white coats in front of legislators in particular, and they sit up and listen. And we've seen that in the State House with some of our more conservative members. When we come in with a doctor or nurse and they speak, they listen, they really do. And so there's the power of that. Well, these people their voices have only gotten more powerful, in my opinion, because of COVID. They've shown that they care about us. So that's a good thing. And then the last part is maybe we're going to start winning this data battle. We've been battling forever about the data and people don't believe the science and all that stuff. Well, COVID is slowly but surely showing everybody that our understanding of public health is pretty damn good. And we had this figured out. And maybe as more and more Americans figure that out, as all these different groups around the country, and Jack, as the item you showed us before, frames things in a public health perspective, maybe more and more Americans are going to trust that. And so that's my story, and I'm sticking to it. And Stephanie's really is going to be helping this summer to take that broad idea and really turn it into some talking points and articulate it.
Well, there's not quite as much room in the public discourse right now for climate but that will open up, I think. Any more questions?
Well, just quickly on that, Steve, I think it is opening up. I think that maybe because I'm just plugged into it a lot, but I think there are more and more articles and more studies being done connecting this pandemic with climate change. I think a lot of scientists who are focusing on climate change are now have this unique opportunity for the first time to be able to see, hey, what happens when the whole world kind of stops, when the whole world stops taking transportation and all this. So I think that it's really starting to ramp up now that we have I wouldn't say under control, but we definitely have a better understanding of the coronavirus. So folks are sort of turning to, oh, well, this is unprecedented. Let's really dive in.
Yeah, and I'm sure that the Climate Crisis Committee in the House of Representatives wouldn't have published their report if they didn't feel that what you said is right, that people are ready to listen.
At the same time, what happens when a middle-aged, working class survivor of COVID-19 is discharged from the hospital in Phoenix, and it's 115 degrees, and that person goes back to their substandard housing and dies of the heat. People are going to begin making those connections.
Steve, I think Bob and Becky had a hand up.
Oh, great. Terrific. Bob and Becky, to you. You're on mute right now, but there you go.
Oh.
Okay. Hi. As energy coordinator for Plainfield, I'd just like to remind everybody that Efficiency Vermont has come out with even deeper incentives for weatherization. So in talking along Peg Elmer's line about better buildings are necessary, and a lot of us can't afford to go out and build new ones, so trying to fix up what we got. The incentives are now as much as 75% of the cost of a job. And a typical weatherization job on a house is somewhere between $7,000 to $9,000 on average. The savings are usually such that it's paid back in 3 years, even if you have to get a 10 or 20% incentive. And now with up to 75%, depending on your income level, that's really huge. And so it's, as energy coordinator, one of the things that we try all the time is to get, we put it in Front Porch Forum, we advertise it publicly. We're speaking to the choir here probably, but there's just a need for people to realize that that service is available. Their home performance with Energy Star contractors are looking for work, and it's still able to do some repairs to houses, even in spite of the coronavirus, working carefully. Their Efficiency Vermont is also offering, we used to do home energy visits where we'd go in and walk through people's houses, look for energy saving opportunities. At this point, they can do a virtual one for you if you have a phone that's connected to, it's basically a Zoom call with you walking through your own house and pointing out stuff, zooming in on different faults in your structure that you might be able to analyze online. It's a little bit shaky right now, but the more people participate, the smoother that process will become. So spread the word.
I'm a big fan of speaking to the choir. I think the choir is a lot further behind than we expect them to be.
Sometimes that's true.
So Eric,
Steve,
a question.
Well,
I'll mention that before and
Oh.
I can help connect you in, and then I don't know how much the town energy committees are aware of the work that Jared Ulmer did on weatherization, showing the health benefits that we were just talking about. There's a really nice 2-page flyer that's available. I'll put the website up in a moment, and also we as the Climate and Health Alliance we're really hoping we get more money put into that weatherization bill last year. We put a lot behind that. So I guess I can offer you and other committees like this in the state that if they'd like some help on the health angle, more than happy to help you in making that argument.
so I think this will maybe be our last question, then we'll turn off the recording and then our speakers can stick around. But Eric, did you want to ask your question?
Clap hands for Efficiency Vermont for all they do, because it's so expensive for anybody that with modest income to do anything to weatherize. And Efficiency Vermont has been doing their best, even though there's a lot more need than there is dollars to help. And but one of the things that I've noticed, and I think the only way we can really make it work better, and that is in the line of getting people to buy electric cars. Electric cars are starting to move in spite of the auto industry, which probably uses them only to help their cafe standards. I have no because they don't really get much profit from it. But they work and people love them. And I noticed that a lot of legislators are actually buying them. And That is the key as far as I'm concerned. And I think that the only way we're going to get more people to get electric cars is to reduce the range anxiety that everybody has that has an electric car. And when I talk to the legislators that already have them, they seem to be not even aware of that problem. And I think that somehow we have to get more people out there and vote to vote. And I think that's the key to everything, as we all know. And I just wanted to get that out there. Electric vehicles, air source heat pumps, and to reduce our fossil fuel use, which is a problem with our society, which is democratic and capitalist. And that's always going to be our biggest fight.
Well, thank you, Eric. So before we turn off, before we turn off the recording, I just wanted to invite you all to our next set of conversations. So thank you so much to Dan and Stephanie for presenting today, and they'll stick around for just a few more minutes if folks want to stay on the line, and we'll turn the recording off. Next week, we're doing a session on the Global Warming Solutions Act. We're going to be joined by Jennifer Rushlow from the Environmental Law Center at Vermont Law School, who worked at CLF and litigated a case in Massachusetts. Lauren Oates from the Nature Conservancy, and Steve Crowley will be talking about the act and what you can do. And then July 22nd, we're doing a discussion on Vermont healthy soils and shifting the paradigm of how we interface with the land. And then the next week is going to be on access to clean water. So those are our next conversations, and thanks so much for joining.